Hi, this is Dr. Heffelfinger, and I'm going to talk to you today about a recent CNN article that came out looking at statistics in plastic surgery. So in 2012, for the first time in over a decade, the number of facial cosmetic procedures has increased much more than body procedures. So things like breast augmentation and the butt lifts are actually on the downturn, whereas facelifts, eyelid rejuvenation, rhinoplasties are on the upswing. And in my opinion, there's probably a few things that can account for this. Number one, I do think people are thinking more about their face and more about the aesthetic of their what you're looking at on a daily basis versus the body procedures. And I think that the baby boomer generation is really pushing this. So people are more comfortable about having procedures on their face, whether it be facelift, eyelid lifts, rhinoplasties, things like that. So as far as what was the number one cosmetic procedure, well, see if you can guess. Number one cosmetic procedure is Botox, and it's been this way for a lot of years. Over 3 million Botox injections were performed last year. I always tell my patients that I think Botox is the closest thing that we have to magic in cosmetic surgery. It works. It's preventive. It gets rid of wrinkles. It's amazing. So as far as the next thing, the number two treatment that was performed, cosmetic treatment that was performed in the United States last year was a laser treatment. So in this, it combined both IPL and all the different kinds of lasers that are available. And I think this can be attributed to the development of technology and the fact that it's safer now. When people wanted to get rid of wrinkles in the past, you're thinking about chemical peels or an aggressive laser. Now with the fractional technology, which we've been using for 5 years, you can very safely, quickly, and with very good long-term results get rid of wrinkles and skin tone texture changes with the fractional laser. So things that we really here at Jefferson Facial Plastics do on a daily basis: facelifts, eyelid lifts, implants, whether that's cheek, chin, we're all up over 5%, and that's in an economy that's actually on the downturn. So whereas breast augmentation and butt lifts are going down, the facial procedures are going up. And what I predict in the future is that as people age, as the baby boomers get older, what they're going to realize is there's no real good minimally invasive substitute for well-performed surgery. So I'm excited about the years to come. I think this turn is a good one, and I'm looking forward to taking care of my patients and giving them the best in rejuvenation and facial surgery. So yeah, I think this turn is a good one. I do think that the face is the most important thing to focus on. It's what people see, it's what people how you interact. It's the first impression that people have of you when they see you. So I look forward to taking great care of my patients in the future, and I hope this upward trend in facial aesthetics continues.